I'm Dr. Jorge Alfonso. I've been on Cape Cod now for a good 20 years as a primary care physician, and I've been at hospice for a good 10 years. Well, as medical director of the VNA Hospice, I'm involved in care coordination, care planning, ethics, decision making, but it's always a team approach. Towards the end of the life of my private care patients, when I started educating them towards the end of life, it was a very difficult conversation for them. And that's what kept me very interested in continuing hospice care, helping them with the family members with the emotional stress they go through, knowing that their family members are going to pass away. Actually, hospice and palliative care overlap. Palliative care is taking care of the patient's chronic illnesses. They want to seek all the treatments available to extend their lives. Eventually, they reach a point where their primary care physicians or their specialists will say, "We have offered everything available to you, and it's time that you should consider hospice." And that's when we come in. We're not involved in extending anybody's life. We're really focused mainly on end-of-life care, quality of life. Hospice services can be provided anywhere, whether it be in the patient's residence or whether it be at the skilled nursing facility, long-term care facility. There's no restrictions. The team can visit the patient anywhere. We have a team approach. We have an interdisciplinary team from nurse practitioners, physicians, all the way to music therapists, and it all enhances their quality of life towards end of life, trying to make it as peaceful as possible, especially their family members, because the amount of stress they go through towards the end of life and the amount of care they have to give their loved ones is enormous. On a weekly basis, we have interdisciplinary teams, and we talk about each and every individual patient, and we craft their care accordingly. Whether it be medication management, do they need more music therapy? Do they need more aids, counseling from social worker? Not only them, but their family members. The patients at home are considered routine level of care, and then the patients at the McCarthy Care Center are considered GIP level of care, which is general inpatient care. But that's what's so unique about the VNA hospice and palliative care. There is no other ICU of hospice on the Cape. We get many referrals from Boston as well, but that's what's so wonderful and so lucky that we have the facility of Mary McCarthy. I think what's really important that for the patient and the family to understand is that we're just not there for 1 hour. We're just not there for 2 hours. We just don't stop working on Friday. We're truly available for them 24/7. There's always a nurse on 24/7. I'm on 24/7. It's a personal journey that I go through because I've also had my scare in life. And so when I think of hospice and the gratitude I get in taking care of patients towards the end of life and the family members, it's very personal. So that's why I've stayed at hospice for the past 10 years. It's basically helping them towards the fear of end of life.